My work pattern is pretty constant. I do night shift. I start roughly 7:30, 8 o'clock and finish 8, 9 o'clock the next morning. Fatigue would build up on the mental health of a driver.
We know that shift workers are at high risk of mental health injury because of the fact they are trying to work at a time that works against their biology.
We had a couple of really concerning events. Drivers ran off the road on the freeway, and that really brought our attention to the fact that the consequences of fatigue, it can lead to poor decision making. Sleep deprivation certainly can lead to higher risk of actually, hurting yourself mentally.
Convenience Advertising was successful as the lead organisation in a consortium that had applied for funding under the WorkSafe WorkWell mental health funded initiative. Our partners were Monash University, the Institute for Breathing and Sleep, and we selected Hazeldene. The project was to look at mental health, those that were working night shift that had a greater disposition towards mental health challenges.
The project itself was mental health leadership in manufacturing, and there were 3 separate studies that were part of that project. The fatigue detection study, the lighting intervention study, and then an app project.
With the app intervention, people can be onboarded, inducted, updated, record data and take earlier action to prevent the onset of mental health challenges.
One of the interventions was introducing fatigue detection technology into their trucks. We wanted to see how implementing these devices would impact a driver's level of alertness on the road.
And it actually picks up that your eyes aren't on the screen. The device makes numerous different sounds for different events, and you've even got the vibrating seat to wake you up.
The devices were able to produce fatigue events behind the wheel, which was closing your eyes for a significant period of time. You could go from an alert going off to a driver receiving a call within 5 minutes, so they could conduct a welfare check. Better sleep is associated with improved mental health. Knowing about their fatigue events could allow them to seek intervention, which would lead to better mental health outcomes for the drivers.
Nobody wants that device to be going off, but if it does go off, it's going off for a reason. It saves someone's life here at Hazeldene, and if it saves just one life, it's a well worth thing.
The other intervention was to do with the production line. IBAS came in and they measured all of the lighting, and there was suboptimal lighting and suboptimal type of lighting.
The lighting study, I think it's endless. Simply change lighting, which fundamentally makes people feel better. A more alert workforce is going to be less incident workforce.
Our light exposure really dictates our sleepiness at any particular time of day, and it also has a huge role in how well we sleep, and as a result, all of those things together can therefore impact our mental health. Some of the improvements that we saw was a reduction in depressive symptoms, a reduction in symptoms of anxiety, so we really saw some positive outcomes for mental health.
One person did have undiagnosed sleep apnea that was found through the study. That can result in a significant injury, and those significant injuries are so preventable if you have, the means by which to actually support the employee through that mental health journey that they might be on.
It plays on you all the time to want to be able to get home safely, and I can imagine it plays on all the other drivers out there.
Mental health and wellbeing is at the heart of everything that we do. We want people to go home the exact same way that they came to work, either physically or emotionally. They go home the way that they came, without any harm. The insights that we've been able to gather from the projects have actually been really valuable to the business. If you have a healthy workforce, you have a productive workforce.